Всем привет! В сегодняшнем видео я покажу вам часть презентации British Health System, посвященную описанию расстройства личности кластера B. И сразу приношу свои извинения за свой несовершенный перевод, который я положила в виде субтитров в это видео. Эта презентация предназначена в первую очередь для психологов и психотерапевтов, которые работают с расстройством личности кластера B, психопатами, нарциссами. И специалисты дают некоторые рекомендации для тех, кто занимается лечением таких людей.
Hello, I am Heather Montross, outpatient manager for behavioral health, and I'm here with Sharon Pendlebury, our administrator. And today we are going to be presenting on cluster B personality disorders. So the objectives that we're going to be covering today is really to provide an overview of the diagnostic criteria for cluster B personality disorders, give some information about the characteristics and treatment for cluster B personality disorders, and then talk a little bit about the suicidality of cluster B and provide some helpful hints when working with this population. So I'm going to go ahead and start with talking about the definition of personality disorders. This comes directly from our DSM-5 manual, and all of the information that we are going to be using today, all the diagnostic criteria, comes from the DSM-5. But a personality disorder is an enduring pattern of inner experience and behavior that is different from the individual's culture. It's pervasive and inflexible. It has typically an onset in adolescence or early adulthood. It stabilizes over time, but it leads to significant distress and impairment in one's social and occupational life. So the clusters in general, there are three clusters. The first one, cluster A, can be classified as the weird or the eccentric. This is your paranoid, schizoid, or schizotypal. We have the cluster B, which we're going to focus on today, which is the wild. These are our antisocial, our borderlines, our histrionic, and narcissists. And then cluster C is the worried. So this is your avoidant, dependent, and obsessive compulsive. So we're going to go ahead and start with antisocial, and I'm going to turn it over to Sharon to start us off.
Thank you, Heather.
Yes.
So, the cluster B personality disorders are the personality disorders that often come to our attention during treatment, either outpatient or inpatient or in the emergency room. People who have these personality disorders tend to be more risky than the cluster A's and the cluster C's, both to themselves and sometimes to others. They tend to be more impulsive, and so they tend to draw attention. And so, therefore, they come into treatment, and maybe with comorbid mood disorders or anxiety disorders, but basically we see them more often than the other clusters, which is why we chose to talk about them. Antisocial personality disorder is one of the cluster B personality disorders. The definition in the DSM-5 is as follows: a pervasive pattern of disregard for and violation of the rights of others that begins in childhood or early adolescence and continues into adulthood. Deceit and manipulation are the central features. This pattern has also been referred to as psychopathy and sociopathy. We'll talk a little bit about that later. Motivation for coming to treatment usually involves somebody else pressurizing somebody to do that for change. It's usually either the criminal justice system or there's financial leverage. There's a problem with relationships secondary to the deceit and manipulation, and there's some financial reason for that person with antisocial personality disorder to engage with treatment in response to that leverage. Or they may come into treatment in order to meet a comorbid need for substances. It isn't a great start for treatment because the investment is rarely there and the insight is rarely there. People with antisocial personality disorder are your straightforwardly the kind of petty criminals that go in and out of jail. They steal, they lie, they need to get what they want, and they have very little empathy and very little conscience, which is characteristic of this class. They really need what they want when they want it. They won't hurt you unless you get in the way. They have no objection to hurting you, on the whole, if you get in the way, but they don't particularly enjoy hearing you scream, but getting in the way would not be tolerated. And if they have to use emotional force or physical force in order to get what they need, then they're quite happy to do that. The criteria for antisocial, therefore, is failure to conform to social norms, repeatedly performing acts that are grounds for arrest. People with antisocial personality disorder do not plan. Most cluster B personality disorders do not plan. They're fairly impulsive. They don't think easily of consequences. They live in the moment. That frontal lobe piece is not well developed, if developed at all. So your planning, your empathy, and your conscience that sits here is underdeveloped at best. So they tend to do what they want to do in the moment and then get into trouble for it and then do it again. Often deceitful, quite happy to con you or lie to you for personal gain. Impulsive, reckless, irresponsible. They kind of live to their own tune, and that means that the boundaries that normally surround our behaviour in a mammalian society, we're community animals, that's why we have laws and mores of behaviour, and that's what works for us. The cluster B personality disorders are not attuned to any of that. They're attuned to getting their needs met and getting people out of the way or recruited into supporting them to get those needs met by whichever means available. So they do lie, and they do con, and they do manipulate, and they might hurt you. This personality disorder might hurt you, but not because they enjoy it. Usually just because it's a means to an end. Lack of remorse. You really need a conscience to be remorseful, and cluster B personality disorders tend to lack one. And so it's very hard for them to feel sorry, and they don't really understand the concept. They're your kind of reptilian brain. They're not your mammalian brain. And the difficulties people have with that is that we project ourselves onto others. When you meet somebody, you assume they think in the same way that you do, that their brain has developed the way yours has developed, and that makes you very, very, you have a huge tendency towards altruism, you have a conscience, you have empathy, it develops, you'll do things for the good of others, and you don't always see others as servants to yourself. Cluster B personality disorders don't have that brain. It's a different brain. And once you know that, you'll know much better how to support them and keep them safe and everybody else safer. In order to meet for antisocial, you'd have to have a history of conduct disorder by the age of 15. This thing starts late childhood, early adolescent, becomes very apparent. We have a psychopathy checklist here. Psychopaths are a little different. They're kind of the other end of this scale, although they come under the same diagnosis. Psychopaths like to hear you scream. Antisocial personality disorders will hurt you if they have to. Psychopaths like to hurt you, either emotionally or physically. And so they can be dangerous, but they're rare. They're rare. Your bog standard antisocial personality disorder occurs much more frequently. Psychopathy is a very sophisticated form of this disorder, and it doesn't happen often. So a psychopathy checklist. People are charming, have to learn to live in the mammalian world and survive in a community setting when they're not community animals. So they learn how to groom. They learn how to be charismatic. They learn how to be charming because they need you, your prey. They need to reel you in to get what they need from you until they don't need you anymore. And so they're very, very good at establishing very quickly those relationships that often would take much longer with normal pathology. Very grandiose. They're narcissistic. They think they're wonderful. And also that gives them some protection from the anxiety that might go alongside their impulsive behavior. They get bored easy, really easy. They kindle low, because it's that reptilian brain again. You kindle to hunt. So they kindle here all the time. Content is not a word that they would understand. They tend to be conning and manipulative, have a shallow affect. They'll speak to the audience in whichever situation they find themselves to get what they need from you. We all manipulate our environment to get the best out of others. But those of us who do not suffer from lack of consciousness or lack of empathy have that altruistic element, which enables us to do things that are fair and just and that be treated as we would like to be treated, if you see what I mean. There is no investment with the psychopath in that. Tend to be parasitic. Why do the work if somebody else will do the work for you, right? Poor behavioral control, get mad. They can get really mad and really, really disguise it. Their anger is their past masters at disguising anger, but it's there and they get angry quickly. Lack of realistic long-term plans. These are not planners, these are reactors, just like the other cluster B personality disorders. Impulsivity and irresponsibility, and they're very criminally versatile. So basically, you have the reptile swimming in the mammalian pond. It's just unfortunate that the other mammals don't tend to recognize that until it's fairly well established, and that can be too late for some. Treatment. Overall treatment for antisocial personality disorder is fairly pessimistic in terms of outcome. In order to get treated, you really need to have some level of insight and motivation. Your antisocial personality disorder, much like your narcissistic personality disorder, thinks they're the norm. So if you can sit long enough to hear what they're saying and get them to talk to you without judgment, then they would tell you that all of this rubbish about either being a sucker or a predator is our rubbish. In other words, you're just like me and you're lying about it. You're just better at this than me, and you look better and you groom better, but you're exactly the same as me inside. Or you behave like this community animal that's fair and just and understands the concepts of partnership because you're stupid. So you're either lying or stupid, but what you're describing to me, I don't recognize. And they honestly don't recognize it because that's not the way their brain works. That's kind of like asking the crocodile to act like the elephant. That's not going to happen. Neither their brain structure, nor their DNA, nor their neurochemistry is enabling that. It's a different world. And it's the world they're living in. And they can't understand or appreciate where the rest of humanity is coming from. But they serve a purpose. We serve a purpose. So, treatment is hard. The improvement of moral and social behavior, you can help that with some cognitive functioning. Certainly as the antisocial personality disorder patient gets older, they tend to burn out a little bit. They start thinking that spending long periods of time in jail is not a good thing. They've had enough consequences, that their impulsivity is lessening with age, that sometimes they can use that as a starting point, and you have some leverage for therapy with that because it's in their own best interest. When they're younger, you're probably not going to be successful. Set clear limits if you're involved in treatment. Keep therapy structured. At the end of the day, they're players. They'll play their therapist just like they play everybody else. And it takes really skilled therapy. I mean, therapy is quite boundaried anyway, but it takes really skilled therapists to be able to work with this population because they need to know what they're looking at, and they need to treat to what they see, not what they would like to see, but the capabilities of that personality in front of them, and set realistic goals and expectations for outcomes. Engage in a thorough discussion of life history, review additional sources of information. It's really important with the cluster B personality disorders. They are not their own best historians. They have no attachment to the truth, none of them. None of the four of them have any understanding of why anybody would tell the truth in a situation where it does not benefit them. So they're very unreliable historians. You'll get a much better history from collateral, maybe formal or informal collateral, professional collateral, as well as family. You usually don't have too many friends, unless the friends are meeting their need at that time. But as much information as you can get from other sources, the better picture you'll get. And then work to identify cognitive distortions. Wanting something justifies the means, justifies the ends, right? Or there won't be any consequences. When you actually get to the point where somebody will engage in therapy, they're usually older, pretty burnt out, and they're fed up with the consequences, and that's your leverage. So you have to work with them to learn how to challenge their own distortions that have been lifelong. It's okay saying it doesn't matter, nothing will go wrong this time. Let's look back at when things went wrong last time, and the time before that, and the time before that, and the time before that, and what the consequences were for you. If you have got any leverage, that would be it. Don't seek to get the patient to feel differently about past behaviours. No conscience, no empathy. Don't try and build that. It doesn't exist and it never will. What you're trying to build is community behaviour compliance based on avoidance of consequences. That's what you're trying to build. Don't set expectations for the development of a personality that is never going to be there. Okay, so that's antisocial personality disorder. Now we thought we'd talk about narcissistic personality disorder. Narcissistic personality disorder is defined as a pervasive pattern of grandiosity, the need for admiration, and a lack of empathy that begins in early adulthood. Narcissistic personality disorder is kind of the common understanding is, I love me, who do you love? Actually, a narcissist's entire personality is built on anxiety. These patients have a hugely dense core of ego anxiety. They cannot tolerate being challenged. That causes ego disintegration and therefore identity disintegration. They have to have the best. They have to be the best. Even if they're not the best, other people have to tell them that they're the best. They need that supply. They will only deal with somebody who's in authority. They will only listen to somebody who has status. All of that is all about self-soothing. They're at their core the most anxious of the personality disorders, even more anxious than the dependent personality disorders in cluster B. And they will mitigate that anxiety no matter what the cost. It's absolutely imperative to them that they are able to soothe that quaking rock in the middle of their being all the time. And the way they do that is by being grandiose, by being entitled, by dealing with people that they think are going to support that for them, and by not tolerating anybody who questions them. They're not able to do that. Their pathology won't allow them to tolerate it. What makes them the most dangerous of the personality disorders is that they are almost always really, really tied to revenge. If you have wounded a narcissist, and you can wound a narcissist pretty easy, you may just be pointing out that it might be better to do something a different way, but you may not be chairman of the board who's doing that. You may just be saying, no, unfortunately we can't do that for you today, sir. It doesn't take much to wound a narcissist. And once wounded, the way they repair their ego is to punish you. And they almost have no choice about that. A narcissist, revenge is a dish best served cold. And until they come for you, they can't settle down. And that makes them dangerous. You have to be really careful. especially when you're in a treatment environment where we would normally set pretty strict boundaries, and that's not going to change for the narcissist. But we know how little they will tolerate that. And we need to have plans for enabling them to remain engaged without sabotaging their therapy, without sabotaging their treatment, and without becoming the focus for their without becoming their victim, essentially. So, personality disorder criteria. They have huge vulnerability in their self-esteem. It makes them very sensitive to injury. A wounded narcissist is not a happy person. Once they're wounded, they're coming. They might not come today, they might come tomorrow, but they're coming because it's the only way they can restore that ego function. You have to be in the wrong and you have to be punished because you've wounded them. What they need is supply, total, unrestricted, unconditional admiration. That's how they blossom. And the minute it stops, you have a very different animal. So, usually they're grandiose, they have a huge self-importance belief, they expect to be recognized. Again, they're usually extremely charismatic because they've spent half their lives developing tools that enables them to get the supply that they need, and so they're very good at working the rest of us. And they work hard. They work hard to get what they need, and they get very angry if that is upended in any way. Preoccupied with fantasies of success, power, beauty, love. Believes they're special or unique. And they have to believe they're special or unique because they're so anxious inside they couldn't tolerate it if they weren't special or unique. And should always associate with others who are special. They like excessive admiration. Nothing is too much for the narcissist. It's making you feel like somebody's got to pass the vomit bowl. They love it. Absolutely soak it up. They will take that all day, every day. The minute you'll have a problem is when you say no. They will not tolerate no. They might tolerate no from the President of the United States without showing their anger. But if it was me that was saying no, or you that was saying no, they may be pleasant to your face, but that revenge is coming, and coming quick, because you don't have near enough status to support that sabotage. You just don't. They take advantage of others. They have absolutely no conscience and absolutely no empathy. And they're envious of others and believe that others are envious of them, and of course quite rightly they're envious of them. And they tend to be pretty arrogant. They are not rule keepers. None of the cluster Bs are rule keepers. But narcissists can do really well if they're high functioning. They can be CEOs or COOs. They get to the top because they're not looking back and they don't care who they're hurting. And they absolutely need to be there. That need for success and need for supply dominates their entire life. And so if they're functional and intelligent and charismatic, they can do well. If they're kind of mediocre, you tend to see that they do well in a setting. They get recruited, they'll do great, everybody loves them, they think they're marvellous. Somebody says no, and it all goes to hell in a handbasket because the revenge starts. It's inevitable. And then that usually gets them into quite a lot of trouble. And then they get fired. And then they go somewhere else. And they'll start again on that kind of little wheel. And then somewhere else. Really outstanding narcissists can get to the top, earn a great deal of money, and stay at the top for a little while. But they have to be sophisticated. So usually with a narcissist, interpersonal relationships are impaired because of the problems of entitlement, the need for admiration, and the disregard for sensitivity of others. The only way to be in a relationship with a narcissist is to give them absolute supply. They will not tolerate dissent. It won't be allowed. So you have to be somebody in a relationship with a narcissist who is always going to subjugate your needs to theirs, always make it clear that how much you admire them, always stand on their side, on their perspective. The minute you even seem to be cracking, you're done. Ambition and confidence can lead to high achievement. However, performance may be disrupted because of the intolerance to criticism and defeat. The minute you say no, they're coming. They cannot tolerate it. And that gets really messy in an organization quite quickly, and then they move on. They're snobbish. They tend to devalue the contribution of others. These are not people that attribute success. So it wouldn't be, we had this great program because Jane and Heather and Dawn got together and look what they did. That is not going to happen. What's going to happen is, look what I did. Who's Jane, Heather and Dawn? Who are those people? That's a narcissist. And they tend to discuss their own concerns in an appropriate and lengthy detail while failing to recognize that others have feelings and needs. 50 to 70% are males. I have seen some fairly decent narcissistic females, but the really superlative narcissists that I know or have treated have all been males. Treatment. They're usually seeking for another diagnosis because there can't be anything wrong with them, right? There can't possibly be anything wrong with them because otherwise they're going to pieces. Their entire being is focused on making sure that there is not one element of a suspicion that there's anything wrong with them. They will not take criticism. They cannot tolerate it, so there's no point trying it. Be clear about limitations and rules. Obviously, your narcissist will ask if your therapist went to Harvard. If they didn't go to Harvard, they will ask why they're seeing them, even if they're the best therapist on the planet, because Harvard's important, right? Find ways to cope with their negativity. The negativity is about everybody else, it's not about them. They have very low arousal tolerance, and they have very low tolerance for anybody else's opinions, views, lifestyles. Everybody else is just prey, essentially. Meet my needs, meet my needs, meet my needs, meet my needs. That's the only thing you're useful for. Meet my needs. And this is how you do that. You do that by being nice to me, telling me how wonderful I am, getting all obstacles out of my way, and stroking my ego. That's how you be nice to me. Identify automatic thoughts and creating balancing statements. Just like all other cluster Bs, narcissists develop automatic responses, and it serves them well. It would be very difficult to get a narcissist to challenge those willingly. If they were going to lose either status or money big time, they might tolerate the process. Honestly, never seen any of them invest in it. So be careful when you're working with somebody who has an established diagnosis of narcissistic personality disorder. Just be careful. Make sure you get a lot of support, make sure you get a lot of supervision, make sure that you partner up, and make sure you give away little to no personal information. Because it's almost impossible in a healthcare setting to always say yes. And that's inevitably going to lead to trouble. Okay.
На этом я с вами не прощаюсь. Ставьте лайк или дизлайк этому видео, подписывайтесь на наш канал и приобретайте книгу «Антипсихопатия». В ней описаны очень структурированно и подробно все признаки, по которым можно определить психопатов-нарциссов, и также много упражнений, которые помогают восстановиться после токсичных отношений и обрести целостность и баланс. Всем пока, желаю вам хорошего продолжения дня.